Hi, my name is Camille and I am doing tuberculosis for my presentation today. First, I'm going to start with a little history about the infectious disease. The genus of the disease is Microbacterium, and it was said that the disease started over 150 million years ago, but the 18th and 19th century is really when the disease took off and the numbers started getting much higher. It was Robert Koch who first announced the disease, and that was on March 24th of 1882. Around that time, it was said that the death rate was 1 in every 7 Americans died from this disease. The occurrence of the disease it happens all over the world. It's found worldwide, and the risks vary by region and profession. So if you were born in a place like Asia, Africa, Latin America, you have a higher risk of having the disease because the numbers are higher there. Also, if you travel to those places, you're at a higher risk as well. And if you're a healthcare worker and you're in direct patient contact with someone who has active tuberculosis, then you are putting yourself at risk, or you're at higher risk of contracting it. The transmission of the infectious agent. So the infectious agent is rod-shaped bacilli. It's fast-acting and non-motile. So that is the infectious agent that gets transported from human to human, and that is what gets you sick. The human is the reservoir. We hold on to it, and it can be active or inactive. If it's inactive, we're just holding on to it, and we're not having any symptoms, and we're not contagious yet. But that can change. You can become active, and in that case, you are contagious, and you do have symptoms. So TB is trans, transferred from human to human through respiratory transmission. If you cough, sneeze, sing, if you're breathing out to another human, they can breathe that in and they can get the disease as well. So it's not passed through holding hands or through eating food or even kissing. It's really only through respiratory. Symptoms. Symptoms include, symptoms, excuse me, symptoms vary. It depends on the location of the infection. And it takes 2 to 3 weeks from the time of infection to you actually starting to feel or show symptoms. So if you have tuberculosis in your lungs, then you'd have a cough, you'd have fever, you could have chills, lack of appetite, you can lose weight, and especially if your cough is longer and lasts like 3 weeks and you have a bad cough, then that's a symptom of it being in the lungs. The lymph nodes, you can have swelling into the skin, the spine, you can have back pain. The larynx can cause you to have a hoarse voice, and if you have tuberculosis in the brain, that can cause headaches and confusion. So, like I've kind of mentioned a little bit, there's active and inactive tuberculosis. So, both of them need treated, and the only treatment for those is medication. So, you need to get a positive tuberculosis test, and you can get a positive if you're active or inactive, and then you need to work with your doctor and get a treatment plan. Without treatment, 1 in 10 patients will develop active tuberculosis. So that's pretty high. So you definitely want to get treated, and you want to make sure you finish your antibiotics, because if you don't, then you might not fight it off. It'll come back. And also tuberculosis, some of the antibiotics it can be resistant to. And that happens if you don't finish your antibiotics. So the treatment plan for inactive is a round of antibiotics, and it can take anywhere from 3 to 4 months of being on those antibiotics until you are rid of it. And if you have an active infection, then it can take 4 to 9 months of antibiotics before you are clear. So some control measures would be practicing good hygiene is the first one. You need to wash your hands. You cough on your hands, and you want to cover your mouth is specifically how we don't want to spread it, because you're stopping the respiratory virus from transferring to somebody else. You want to get tested if you've been exposed. So it's important, if you've been around someone who has it, to get tested so that way you can get on antibiotics and you don't have the chance of it turning to active and you getting sick and getting other people sick. You want to have a safe distance. Once you know what the symptoms are, if you see somebody coughing their head off, you want to make sure you stay a good distance away and protect yourself from that. Like I said before, you want to finish prescribed medication. You don't want to take the chance of it coming back or you developing um, antibiotic resistance. And you want to modify travel. If you're going out of the country to any of the places that I listed, you want to check and see their numbers on the places that you're going so you can protect yourself. Here are my sources. Thanks for listening.